Hi, welcome to another episode of Hot Takes. What are targets? Well, targets are what SNP ministers give themselves so that they've got something to miss. Because they never ever meet their targets, do they? One of the targets for Neil Gray when he came into office, all those, 5 months ago now, 6 months ago, was that he was going to bring down waiting lists. And he had negotiated an extra £30 million for people on the waiting list. They would target those waiting the longest. They would bring down the waiting lists that they claimed were a result of the backlogs caused by COVID. Turns out the waiting lists were already there before COVID. And indeed, with COVID, they actually managed to slightly reduce the waiting list through that period. It's subsequently grown in the sort of 3 years after COVID. It's weird, isn't it? But then he comes in 6 months ago and he gets 30 million. He goes, right, that's it. We're going to hit the ground running. We're going to do this. We're going to bring those waiting lists down. Well, what do you think's happened, children? Well, the waiting lists have gone up by 24,000. There's now nearly 900,000 Scots waiting for a hospital appointment for treatment. This is embarrassing, but not surprising, because after all, it is the SNP. For them, they can sit there and give themselves as many targets as they like, but they are effectively every single one of them unachievable. It's what happens when you put a man like Neil Gray in charge of the health service, though. He previously was a Ministry of Energy, and, well, it's a small ministry. There's not a lot to do. You don't have many staff. It's not as though you're meeting people. Everything is a paper exercise. Then all of a sudden, he goes to the biggest one, health. A portfolio he's got no experience of running, something that big, something that expensive, with so many people, so many problems. And instead of just dealing with problems in paperwork, he's now dealing with real people, because people are waiting for their operations, for their treatments. Cancer treatment especially is appallingly bad. And so all this money that he insisted would make, 40,000 new diagnostic tests, 12,000 procedures, there'd be 12,000 new appointments that'd be placed, and all this with this £30 million. And it's mainly made people, it's worse, isn't it? It's just getting worse, continually worsening. And this is a result of him. It's his action, because he felt that he knew what he was doing. He's only the minister. He knows nothing. You've got to remember that ministers of state generally have got to their position not because they're good at their jobs, but because they're brilliant at kissing arse. These people are all lickspittles. They're all little chavvy boys going, "Oh, I'll do it for you." They're on their knees sucking. That's how they get to the top. Arse kissing and sucking. Give you a blowjob or you make me Minister of State, that sort of thing. This is it. They're not experts in the field. There's very few ministers that have experience in that which they are administering. To be fair, and I mentioned Tobias Ellwood earlier in the previous video, he was the Defence Minister. He was a Lieutenant Colonel. This is a man who was in the military, so he knows. But there's not many of them. And I don't know whether they do it deliberately. They say, "Oh, well, he knows a bit about health. We better not make him the health minister because he might know how to fix things. And that might be expensive." I think that's the thinking. And so they get morons and put them in. And then they think they know. They won't talk to doctors. They won't talk to nurses. They won't talk to people at the pointy end of the problem. They won't talk to people who actually work in the hospitals. No. That's the last thing they want to do. Meeting with normal people, meeting with people who know what they're talking about. They'll make me look stupid. No. This is what I'm going to do. And the problem gets worse. Now, there's a guy called Alan Robertson, no relation to Angus, I hope. I don't think so. He's the chairman of the BMA Scotland Consultants. And he said whether these constant targets that what the government set themselves were ever going to be achievable. And he says no. He says because these targets are driven by ministers, their policy wonks, their spads, their team around them. They're not driven by what the doctors say they need to be. He said basically, if you just give doctors the resources, they could cure the problem by curing patients. But in order to get those funds, you have to go through reams and reams of paperwork, filing reports. You're spending half your time pumping crap rather than treating people. He says, just put it in and leave us to it and we'll sort it out. But of course, the SNP can't do that. They have to micromanage every single aspect of every single sector. They have political people in hospitals. They have the Ministry of Health will have officials in the hospitals making sure that the hospitals run exactly how the government wants them to run, rather than letting them run how doctors want them to run. And that's why patients aren't getting cured. When a doctor is wasting 5 or 6 hours a week on paperwork and bureaucracy and sending in reports, that's 5 or 6 hours not seeing patients. I mean, that could be 30 patients a week per doctor. Multiply that by 52 weeks. Multiply it by the thousands of doctors. Do we see what the problem here is? It's the SNP government themselves. And so you can keep throwing £30 million at the problem, but that isn't going to sort the problem because the money isn't the problem. It's all the interference. There are 2,000, I'm going to give you the numbers here, I'm going to have to just pull these up, because although they're desperately trying to get rid of these lists, but by the end of August 2022, more than 2,024 people had been on the list for 2 years. That's risen, that's doubled in the 2 years since 2022. There's also 7,146 waiting 2 years again for treatment, again breaching the target of ending it, and it's just consistently, when you're on a waiting list for 2 years, and it's not mentioned in this article, but I just happen to know this, there are mental health patients, this is separate from this, but I just happen to know the numbers. As I say, there are mental health patients out there who've been told that the waiting list is 6 years. Now, I'm not a psychiatrist, I'm not a psychologist, I'm not an expert in this field, but I am a human being, and I know that someone with mental health may not make it 6 years. They may have deleted themselves. They may have taken themselves out of the equation in those intervening 6 years. And yet, for most of them, there's probably treatment available, but having to wait 6 years. And then the SNP government complained that there's a massive rise in private medical care. Are you wondering why? It's a joke. Neil Gray is the least suited person to be the health minister. He's the least suited person to be any kind of minister. He's like the rest of them in the SNP, utterly clueless. Only this time, he's not wasting money. He's killing people. Thank you very much.